Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to this episode of AFMC TV. I'm Robin Ledbetter. Thank you for joining us. I have with me today President and CEO of AFMC, Mr. John Selig. Thanks so much for joining me.
Sure.
So you were on AFMC TV about a year ago.
Yep.
Almost 1 year ago.
Yep.
And you talked a lot about your vision. What has changed in this year that you've been president and CEO?
You know, I don't know that a lot has changed. I think of course, I need to go back and look at that episode. But my sense at the time, because I knew AFMC, at least from the outside, was that really what I wanted to do was probably be building on the progress that had been made to date, because I knew AFMC was a well-run company. I think what's different for me now is I certainly know the details of how the company works better, and having had a chance to talk with lots of employees and get feedback in the programs, have a better sense of our capabilities. So I don't know that the vision has changed so much. I think we want to focus on having an impact in Arkansas, really improving health for communities and for individuals. And that's going to continue, I think.
And the healthcare model has changed. What have you seen in the last couple of years?
I think probably the two big changes I've noticed, I'd say in the last, it may be 4 or 5 years, but one is there was a real focus before on just getting people coverage, insurance coverage. We now have, most people have insurance coverage, although obviously with the Medicaid unwind, some people are losing coverage, and hopefully they're finding coverage elsewhere or will soon. But there seems to be more focus in recent years on access to care. I think people are realizing, certainly in the healthcare community, that just having insurance coverage doesn't particularly help if you can't find care in your local community, the kind of care you need when you need it. So there's more of an emphasis on that. And then the other thing that's happened, I think, particularly in the last 5 years, is this focus on social determinants of health. And I know you've had some segments on that, but just the idea that the actual health care you get probably has 10 to 20% impact on your personal health and your social environment, your education, your access to food, your access to adequate and safe housing, those types of things may have more like 60% impact. So I think everybody in the healthcare community has an understanding that we can't just focus on your medical needs. You've got to do more around social determinants. And of course, we're trying to do that with AFMC too.
And there seems to be a focus on people taking responsibility for their own care and health. How does AFMC play into that?
Within the company, we're trying to promote that through our Wellness Works program, where we incentivize employees to get the preventive screenings, just see their doctor once a year, to be active, to whether that's through exercise, to eat well, et cetera. And in our case with AFMC, if you do those things, you can get a significant reduction in your healthcare premiums. So it certainly benefits the employee to be healthier, but it benefits us as a company to lower our healthcare costs, because that's a huge cost driver for everybody.
And you maintain an open door or open computer policy, because a lot of our employees are remote now.
Yep.
What would you say, or how has that kind of shaped the culture of work here within the company?
I don't know what it was before. So, to me, I don't know how you operate with something other than an open door policy. The idea of kind of telling everybody you've got to communicate through some chain of command, I think for me, it's like telephone tag. By the time someone, whatever they had to say of worth gets to you, it may or may not be the same message as before. So I really like to hear from people. I think it's really good to kind of cross-pollinate, for people to be able to talk across the organization. And it's just refreshing for me to be able to talk directly with employees and hear their ideas and suggestions. I think for us as a company, we really do try to work as a team. And that means people have to feel like that their input is valued. And I certainly value the input, and I think all of our team does. So it just seems like a natural thing to me. I can't see operating in some other way.
Well, and there's also lots of opportunities for growth. What do you see those biggest opportunities are for us on the horizon?
Yeah, I'm not someone who thinks with AFMC kind of as a nonprofit organization with a mission. I don't see us wanting to do growth just for growth's sake. So for me, growth is important, but maybe even more important is impact. So what's our ability to have an impact in the community and improve the health of Arkansans? And I think certainly one of those areas is around social determinants of health. And we've done a lot in this last year, that we can talk about So in areas that are not just medical per se, we still have, core services, for example, around clinical services and quality, but we're trying to do more in these other areas.
And AFMC remains focused on multiple areas of healthcare improvement, quality improvement, as you mentioned, in our contract work, but there's still lots of other capabilities. How can we capitalize on those capabilities, both within Arkansas and outside of the state?
Yeah. Well, you're right. So a big focus of ours, and the company got started really doing quality improvement work. We still do a lot of that. We do it for Medicaid. We do it with nursing homes and hospitals for Medicare. So we're going to continue to do that. But we have increasingly, one of the things I found when I got here is we've got such good capabilities around data and systems, around our call center, our provider relations. And those types of capabilities are easily transferable to other areas. People in social programs, they want to know their programs are running well. They want to get good data and good reports. They want to be able to have good connections with providers and with, we do a lot of work around beneficiary relations and being able to talk to your beneficiaries. So I think a lot of what we do is transferable elsewhere.
And being data-driven is so important in this industry.
Right. Yeah, it's interesting. When I was at DHS, I used to say, kind of jokingly, but kind of not so jokingly, that if I accepted every idea that came to me that was guaranteed to save us money, we'd have gone broke. Everybody thinks their idea is the best and that they're surely you want my program. And I think it's data that really helps separate and help you identify what does the evidence really show, what's really working, when do you need to change what you're doing? So I think being data-driven for us as a company is really important, but our clients are very data-driven. They want to see, are they having an impact? Is what we're doing effective? And I have to say, our team is just terrific at doing that, giving them reports that are really actionable. They can say, oh, if that's what you're telling me, then I can do this. So I think it's terrific.
When you use the word impact, which leads to the next question, what kind of impact have you seen AFMC make on the state?
Yeah. AFMC, this is our 50th anniversary, and I think the impact, I've known AFMC for 20 years, and the impact to me has always been really helping fill the gaps and improve the quality and improve awareness, getting people more engaged in healthcare, helping providers, in some cases, just understand how, for example, the Medicaid program works so that they can reduce their administrative burden. We have, in this last year, actually, as part of our strategic plan, added a particular pillar on impact because we want to be really intentional about that and say, okay, the opportunities we're going after, can we have an impact? In other words, we don't want to just grow, but is it something that's going to make an impact? When we're able, as a nonprofit, if we have some retained earnings that we can use in the community, where can we have an impact with that? For example, we do a lot of work around adverse childhood experiences. And I know you've talked with various people on here about that, but that's an area where we think, it's a gap in Arkansas. We as a company can make a difference there. We recently did a program or project with the Division of Children and Family Services to try to improve the collection of data around adoptions. And that's just something we just did because we thought, that's something where people are trying to adopt, they're trying to do a good thing. DCFS is overwhelmed. We've got all these capabilities. Let's try to use them and see if we can help improve that system. And it's been a great project.
And there's an exciting new project, the Arkansas Aware Program.
Right. And
tell me a little bit about that and how AFMC plays a role in that.
Yeah, we're very excited about it. So that's a program. We just got a grant of, I think, $8.8 million that'll go over about 5 years from the Substance Abuse and Mental Health Administration, which is a federal agency, to work in the schools doing two things in particular. One is to set up a call line, kind of a support line for teachers around the state who are just kind of overwhelmed with their workload, overwhelmed with the stress of being a teacher, trying to do it well, and really need someone to talk to, kind of a place to vent. And as part of that, what we'll do is have retired teachers who also have some behavioral health background, just kind of available to work with them and if necessary, refer them on to resources and say, here's some tools you could use or some techniques. So that's gonna be statewide. And then we're gonna work with 3 specific districts, really trying to improve the behavioral health programs in the schools for the students and try to bring the community more in line. And for us, I mean, we've already been doing some work in behavioral health, but this is an area for us, as we've talked about, kind of diversify our work to really focus on those social determinants of health. We've got new partners. We're going to be partnering with Arkansas State, who will be evaluating the program. We're going to be working with a number of the state's behavioral health providers. We're looking to the Department of Education to make sure what we're doing is consistent with where they're headed, so we're getting guidance from them. So it's just a great project. We're very excited.
It sounds amazing.
Yeah.
With potential to help so many in the state. So on that note, and before we close, let's talk a little bit about your vision for the next few years and where you see the company headed.
Yeah, well, I smile because when I met who's now my wife, Jeannie, when I met her family for the first time, we're sitting around their dinner table. And at one point, kind of after we've eaten, it gets kind of quiet. And her dad says, "John, what's your 5-year plan?" Give me this stern look. And I said, "Sir, I have no idea." And I not that I didn't have some idea of kind of opportunities where I want to go, what I was interested in, but I think I've always been somebody who didn't say, here's where we're going to be so many years from now, but more so saying, let's really make sure that our capabilities are, that what we do it really well, that our customers are happy. And if we position ourselves well, then when opportunities open up, we can take advantage of them. And that's kind of what I see here at AFMC. I can't say we'll be here in 5 years, but I can say, I think with the team we have, with the experience, the way everybody works together well, the sense of commitment, I just think we're really well positioned to have an impact and to grow in the future.
I agree. And so much of that is illustrated under your leadership. So thank you.
Oh,
thank
thanks.
you for all that you do. And I think the future is bright for everyone here.
I do too.
It is. Well, thank you so much for joining me today. And that's it for AFMC TV. I'm Robin Ledbetter. Have a great day, and thanks for watching.